Hi, everyone. Thank you all for being here tonight. I appreciate you taking the time to come talk about solutions. My name is Ryan Fowler. I work for the Doorway at Granite Pathways in both Manchester and Nashua. I'm in a community engagement role, and I also oversee naloxone distribution for both of those regions. But I'm here to tell you a story about myself tonight. So, believe it or not, 5 years ago to the day, I was a homeless injection drug user sleeping in a tent in my friend's backyard in Hampton. I'd been using and selling drugs for about 10 years. I did have a job at that point, and I was on a Suboxone program. My days looked like driving my uncle's unregistered truck on back roads to Seabrook so I could work at a fireworks store and sell drugs to support my, again, growing habit. I had tried residential treatment 2 times in the past and some outpatient counseling, but I was about to be kicked off of my Suboxone program again because I wasn't ready to stop smoking cannabis or injecting cocaine. Many of my longtime friends had kind of written me off for dead, and I had stolen from a lot of my friends and family, so my social circle was growing smaller and smaller by the day. And even my faithful dog, Zeb, had really been growing tired of my antics. He was sleeping in the tent with me. Mornings were getting hot, and he really didn't like the drives to Lawrence, Massachusetts to buy heroin. My life wasn't going too well. But it was the spring of 2014, and I had no idea that I would soon experience some of the worst psychosis of my life several times, each time getting worse, precipitated by drugs and my underlying mental health conditions. I didn't know that I would overdose 3 more times that year, even needing naloxone for the 3rd time in my life. I did get kicked off of that Suboxone program, and I went back to a daily heroin habit, but I wasn't aware at that time that my heroin supply was all fentanyl, and there was no longer heroin in the state. And I only know that because of the toxicology reports from my last overdose showed that there was no heroin in my system, even though I would have told you that I was using diacetylmorphine. And I certainly did not imagine that I would be in residential treatment 2 more times that year, and I would even spend Christmas and New Year's of 2014 in rehab. I would get out of rehab and utilize 9 months of mental health counseling, which was made possible by Medicaid expansion, and I've been sober ever since. So fast forward to today, like I said, I work for the Doorway at Granite Pathways. I'm fully insured, health insurance, car insurance, life insurance, all that fun stuff. Yay. But I still pay for health insurance. So I'm actually building credit. I'm a published journalist. I've been in Newsweek. I've been in the Concord Monitor. I love my life. I drive the car I've always wanted. I live in a beautiful home with my wonderful girlfriend, Karina. I've honestly never been happier. And, not to mention I love my job overseeing overdose prevention efforts in the state where I was born and raised. I'm using those negative experiences for good. And I really am grateful for that. I really am. But just to be honest, my recovery story is a little, kind of played out. It's a little boring. It's a little typical. I hit a bottom. I found God. I found the 12 steps. Now I'm sober. We've all heard the recovery narrative. We need different voices for the recovery advocacy piece. But what I really want to, nail home is the story of the last 5 years of my active drug use. The truth is that I'm alive and healthy because of harm reduction. Medication-assisted treatment did save my life. Naloxone saved my life. Alternative sentencing saved my life. 2 of my best friends illegally provided me access to sterile syringes and educated me about my behaviors. And because of the education and training that I received as a 20-year-old injection drug user, not only am I alive, but I'm healthy. And I even have some papers to prove it. And harm reduction works. It really does. We know this. Years and years of empirical research and evidence shows us that syringe service programs, low barrier access to cost-free naloxone, medication-assisted recovery, on-site drug checking programs, and supervised consumption spaces, and drug policy reform are what needs to happen if we were to adequately address the drug crisis like the one we're seeing outside here in New Hampshire. And New Hampshire's doing well with that, except for the drug policy reform piece. And when I say drug policy reform, I mean creating a system of care that doesn't involve punishing people for using drugs. New Hampshire is solely embracing harm reduction, but failing to address the overarching issue, failed drug war policies and programs like Granite Shield. The war on drugs has been won. Drugs won. I hate to be the bearer of bad news, but opioid use isn't going away. There has never been a drug-free community, and there will never be a drug-free community. So we need to redefine success. Punishing people for using drugs does not work and actually causes more harm than good. Keeping people who use drugs alive is the new metric that matters. Reducing mortality is the goal, and harm reduction is the solution that we're looking for. To put it simply, dead people don't enter recovery. And with harm reduction, all drug-related death and disease is preventable. And I've lost far too many friends to preventable death and disease. So if you're looking for solutions in the midst of this crisis, you've found it in harm reduction. Thanks.